There's several things you need to understand before doing this procedure. However, you don't really need to even understand them, but I just want to give you some background on how this really works. The body is filled with these electrical circuits, and circuits are circles of information. You have these signals from the brain that go down to one side of the body, and then they go down to the other side of the body, and they're both in coordination. So the left side of the body is coordinated with the right side of the body. In fact, the front side of your body is coordinated with the back part, and you have all these coordinating electrical connections. And this allows movement. So anytime you have a movement, you need one part of a muscle contracting and the other part of the muscle in a relaxed state, or you don't get motion. You can't have both parts of the muscles in tightness. It's just kind of like if you were to drive down the street with your foot on the gas and the brake at the same time, it won't work. So what we're trying to do is we're trying to work on the mirror image side, because as soon as you trigger one side, the opposite side is affected. Okay? So let's kind of go through a couple little slides here. Here's some things that we need to talk about. When you have a soft tissue damage, like you have a muscle that's tore or damaged or overstretched, it can no longer fully contract and relax appropriately. This causes a major imbalance with weakness, pain, and stiffness. So applying strengthening exercises to a weak, painful, tight, damaged muscle, all that does is it creates re-injury to the soft tissue. And this is pretty much what traditional methods currently use. They actually take the area that's weak or in pain or inflamed, and they kind of move it and they stretch it and they work it and they put therapy on it. So when you stretch, so we talked about strengthening. Now if we stretch a tight muscle, guess what? There are things inside that muscle that will counter and protect the stretching. They're called stretch receptors. So when you stretch a damaged muscle, it just acts like a rubber band and it contracts harder. And so now you go from a tight muscle to a tighter muscle. And believe me, in school, what they teach you is that if you have a tight muscle, you stretch it. Well, that might work, but typically what happens is that muscle is tight or out of balance because of an old injury. And I'm not just talking about an injury that you had like maybe in a car accident. I'm talking about sitting behind a computer for many years in one position. What do you think that does to your muscle? It creates a tightness over time. It creates sustained stress over time. Our bodies were not designed to do that. So when you have a damaged muscle that's tight, the nerves within that muscle tend to counter relaxation. So trying to use force to try to stretch this tight muscle is working against the body. So in this technique, you're always going to take the opposing side and you're going to stretch, you're going to rub it, you're going to stimulate it, you're going to activate it. All right. So to improve flexibility in a joint, you work on the opposite side. So you can work on the opposite side, right and back of a muscle, or you can work on the mirror image side, which is basically in this slide right here. So you can go left to right or front and back. So what we're trying to do is we're trying to get rid of what's called the protective mechanism after an old injury. And this could happen 20, 30, 40, 50 years later. You might think that, oh, that was an old injury, that's gone, but it's still there 100%, and your body is still stuck in it. So when you have this guarding, this muscle guarding in a joint, to achieve relaxation, we must work on the opposite side. Then, once you get rid of the guarding and the pain, then you could start to work on the same side, but only after you take this protective mechanism and dismantle it. This is something that is not very known. It's not broadly promoted. It's not done by many healthcare practitioners. So this is what I'm trying to disseminate to you, just to show you how to do it and other practitioners as well. Okay, so in summary, stretching, stimulating, triggering the opposite muscle or area causes a turn-off message to the painful or tight muscle, thereby causing relaxation. Okay, so a couple more things. How much pressure are you going to use? The amount of pressure you should use is based on your tolerance. You're not going to go too light, you're not going to go too hard. Kind of a medium pressure because it's subjective. Each person is different. You want to do it so you can kind of feel it, but not so it's excruciating because we're not trying to traumatize the body. So you should, when you press on the opposite side, it can be extremely tender, so you better go to your tolerance. And just so you know, as you do this over time, this tenderness will go down and it'll be less and less and less and less. How long do you press on the opposite mirror image point? For about 30 or 60 seconds is enough to create the correction. How often should I do this procedure? Well, this depends on several factors. How long it's been there, how severe the pain is, and how many times you do it. In fact, if you do it several times a day, it's going to speed up the process. So you could do it pretty much every day if you want. But again, if it's sore the next day, give it a break. Let all the soreness go away and then do it again. Special note, press to your tolerance. I don't want you to bruise yourself. I mean, if you're on that drug called Coumadin, which is a blood thinner, which is basically going to make you bruise, you're not going to press very hard because we don't want to create bruises, but some people do bruise, so you want to go very lightly. But you could even do rubbing. Instead of pressing, you can actually rub the opposite area. It works the same. Alright, now for pain, step 1, locate the pain exactly. Identify the exact point of the pain and go to the opposite. But before we go to the opposite, you have to rate the pain because we want to scale from 0 to 10, 10 being the worst, 0 being no pain. How would you rate it? The reason why we're rating it because we're going to do an after rating effect so we can see the improvement. Now what you're going to do is you're going to go to the opposite side, which is the mirror image side of the pain, and then you're going to press, rub, or stretch the area for 30 to 60 seconds. And at that point, you're going to re-rate the original pain, and if it improves, that means you're on the right thing. If it doesn't improve, all that means is that it could be referred from somewhere else, and you're going to do the referral technique for this procedure.
Hey, this is Dr. Berg here. In this video, I'm going to show you how to get rid of any pain anywhere in the body. This is the basic technique. There's an advanced one that you're going to learn. The advanced one is really cool, and this one's very cool as well. So I want you to learn both. It's just two different ways, angles into this case. Now, as you learned in the little intro video, everything on the works on opposites. So if she hurts right here, you press right here. Okay, so we know that. Okay. Now we also know that if she hurts right here, it's going to be twice as tender on the opposite side. Okay, so I've already taught you that too. So if she hurts here, I'll press here and I'll find the tender spot, and she'll go ouch, and I'm like, okay, and then you just hold this pressure or rub it really good, or take a massage tool and vibrate it. But the way to fix anything is treat the opposite. Okay, so that's what you know, and you can do it anywhere in the body. You hurt here, you hurt here. Okay, and we also know that if it's anywhere on the front part here, we can go over here, or we can go on the back. So let's have you stand up for a second. So anything on the front, actually anything on the back right here, we can go on the front. So we would just pretend there's an arrow through this. So if she hurts here, we press here. If she hurts here, we press here. And I'm not flipping you off, by the way. So we got that, right? And if it's the lower back, and just so you know, she was just pregnant and she just delivered a baby. So, okay, if she hurts on the lower back, we can work on the front. And I'll show you some examples on that too. So lower back stuff, you work on the front part and you press in there. All right, so have a seat right here. So that's the idea of opposites. Now, there's another layer to this. If she hurts right here, we can press right here, but we can also press up underneath there too. So we can actually press up underneath this point, and it'll be twice as tender. So you have an option. You can go opposite or other side. You can do opposite or other side. If she hurts right here, we can do opposite or other side. Okay? So on the ankle, hurts right here, we can do opposite or other side. Now realize that, let's say for example she has Achilles tendon problem. That's a little tendon in the back part right here. You're going to work on the front. but you can also work on the opposite side too. But just kind of think about the concept. If she has flat feet, that's where the problem is. We work on the front part of the foot. So that's kind of how we do it, okay? So if she hurts on the thumb, we can work on this side right here. All right, so that's pretty much simple, right? No problem with that. You got that? Now, let's take it one step further. In Chinese medicine, there's this word called contralateral. What the heck does that mean, contralateral? It means that the upper part of the body is connected to the lower. When you walk, this shoulder follows this hip. This elbow follows this knee. This wrist follows that ankle. So in Chinese medicine, this shoulder is connected to this hip, this elbow connected to the knee, this wrist, ankle, thumb, big toe. Okay, that's what that means. So that means if she hurts on the big toe, big thumb, we can actually work on the opposite big toe. And you can rub on that and get rid of the pain. If she hurts on the elbow, I can work on the knee and get rid of that pain. This is really amazing. If she hurts on the right shoulder, I can work on the opposite hip. So if you think about it, make a muscle. Make a muscle. Wow, that's pretty good. Okay, so this right here muscle, this is a flexor, okay? Make this muscle good. This is associated with the opposite thigh muscle, but of course this is the flexor, so it'd be up underneath her leg. So if she has a problem with this muscle, I can fix the bottom part. On the back part, that would be this part right here. So you have to kind of like play around with this to see the different parts of it, but that's kind of what you would want to look at as well. Now, the last part I was going to show you is, and there's an advanced video on this that is in another program that goes through it in detail. If you really want to become a master at this technique, which I'd hope you'd want to be, but it's quite fun to do this, and you'll learn every part of the body and examples and things. But here's the thing that I want to tell you about. If you have a problem on this ankle right here, we know we work on the opposite ankle, but you also have to work on the muscle connected to the opposite ankle. All right? So if she hurts right here, I'm going to work on the muscles right here, like her calf. And it'll be very tender right on the opposite calf. So I'll work and massage the calf, okay? Now, if it's the wrist, carpal tunnel syndrome, I'll work right here, okay, on this muscle. Just remember that. Also, if it's this knee, I'm going to work on this thigh. Not just the knee, opposite knee, but the thigh itself. And the reason I'm telling you that is because you've been supporting this leg for a long time by hopping on this knee right here. So you're going to have to work on these muscles through here. And you might have to massage them, and they're going to be very, very tender. So we have opposites, we have contralateral techniques, and then we have opposite muscle connected to this opposite point as well. And then we have the principle of twice as tender on the opposite side. So it's always going to be twice as tender. So if she came in with a toothache right here, we can press right there and help the pain. Of course, if you have eye pain on the right side, we're not going to press right there. That's something you wouldn't do. But you could. No. So that's kind of giving an example. That's kind of an example how you use this technique and the different aspects of it. So I want you to practice this and send me your success stories.
In this video, I'm going to show you how to get rid of any stiffness or tightness anywhere in your body. All you do, and I'm going to keep it extremely simple, is you're going to compare two motions to each other. So let's just take the neck, for example. And again, you can apply this to any joint, wrist, shoulder, back, whatever. So we're going to take, let's say, your neck. And for this example, we're going to have you go forward. You're going to flex your neck forward all the way, and then you're going to flex your neck backwards all the way, and you're going to compare the two motions to which motion does not move as much. Then what you're going to do is the motion that does not move as much, let's say, for example, when you tuck your head forward and compare it to going back, going forward is the most restricted or tight area. The correction is going to be, you guessed it, stretching your neck going backwards. Why? Because we're doing the opposite. Now again, this is completely different than any other stretching technique, but it works so well. So if your neck can't go forward, stretch it backwards and just rock the motion back, stretching backwards and then relaxing, stretching backwards, relaxing, and do that for about 10 times. So again, the correction of fixing tightness going forward is stretching in the good side or going into the backward motion. Now if you find that your restriction is restricted going backwards, so you can't move your neck backwards, you guessed it, you're going to stretch your head going forward. Interesting, eh? So I want you to go ahead and do this to your neck just so you can see how it works, and then you're going to apply it to any part of the body.
Hey, Dr. Berg here. I'm going to show you more on how to do this pain technique. There's various different types of pain. Now, Tony has pain in his neck and the upper shoulders. A lot of people have tightness up here, and they think it's in the muscle. So what we're going to do, the principle of opposite, we're going to work on the opposite muscle. So the opposite muscle to this muscle, and I'm going to teach you, this muscle actually brings up the arm. So bring up your arm right here. Okay? So what muscle would pull the arm down are the muscles underneath the armpit. Okay? So all we have to do is we can stimulate, stretch, massage the opposite muscle. So if we want to melt these shoulder muscles, we can work up underneath the arms. Now it's going to be real ticklish, so I don't know if I want to do that to him. Is that ticklish?
Not ticklish, luckily for me.
Okay, it's not ticklish, but it's extremely painful. So the muscle opposing the tight muscle is going to be painful. Remember, it's always painful on the opposite. So what we're going to do is we're going to stretch it. So I'm going to take my fingers and just hook it up underneath the muscle and kind of raise it up right here. And then I just want you to relax, Tony, all the way. And I'm just going to just hold this thing, just stretch it right here. And I'm just kind of stimulating the muscle underneath the armpit. Now, and I'm relaxing it, and I'm stimulating this right here. Relax. Let me have it. People want to help you. So I'm just kind of stimulating this underneath the arms. And what's happening is this is going to be softer and softer, and it's going to melt. It's like mush right now.
Yeah, I can feel it.
So,
It's bizarre.
yeah, so we stretch this up. Okay, relax it. Let me have it. So the principle we're going to talk about today is how to fix muscle tension. So if the person has tightness, you work on the opposite side here. Now, let's have you sit right here, Tony. All right. So now I want to show you, let's say he has a pain in his hamstring. The hamstrings are usually are really tight on lots of people. So you would think, logically, we're going to stretch the hamstrings out, right? Well, no, we're not going to do that. We're going to actually work this muscle, because the hamstrings are underneath here and the quads right here. And this muscle is what we want to stimulate. So we can just massage this right here. And you can just relax your arm here. We just come down here and work this muscle right through here. Now what's happening is we're loosening up his hamstrings. We're sending neurological signals to the opposite side, and his hamstrings are going to be looser and looser and looser and looser. Okay? We can kind of work this out a little bit right through here. Okay, now go ahead and raise this arm all the way up to your head, as far as up as you can. Okay, good. Now put it down and then raise this one. And tell me if there's any restriction either side, tightness.
The only restriction I feel is kind of here.
Okay.
On both sides, like when I feel
tightness right there.
Yeah,
okay.
quite a lot actually.
Okay. So what we want to do, if he, well, let's do some other things right here. Do you have any pain in the shoulder at all, or tightness in the shoulder? Like, do this for me. How about the other side?
Yeah, so the tightness is like here.
Okay.
Same, it's more on this side actually, but it is a bit here.
Okay.
Kind of around there.
So what we want to do is compare both sides and find out the tight side. And I think you said this is too tight right here, right?
Tighter for sure. Yeah.
Okay. So he's pointing to his rotator cuff. So if you just turn this way, all the rotator cuffs are right here. So what we're going to do is we're going to work on the front part right here. Yeah. And then we just work this out for about an hour or two. That's okay. So we just stretch that out really good there. And we're just stimulating it. And I'm barely touching him.
It's like
But
really tender.
those fingertip push-ups helped last night. Okay. So it's all tight through there. Okay, so now what we did is we worked on the opposite muscle. Okay, so now go ahead and do that same thing and see if it's changed.
It is better, yeah. I mean, it still kind of throbs a bit, but it's not as tight, that's for sure.
Okay, so I just want you to get the concept of this. If it hurts on this side, you work on this side. So there's also a thing called carpal tunnel syndrome. If we take his wrist, and he hurts right here, we can work on the opposite side right here. But in the last video, you want to work up through here. So if he hurts right here, you're going to work through here. Okay, right through there. Right there. Okay, now the other thing I want to mention, there's a couple, when people are stressed, they tend to do this. They got this neck muscle, and the hamstrings get tight. The next thing I want to talk about is your neck, because you typically have tension in the neck.
Yeah, most of the time.
Most of the time. So what we're going to do is we're going to show you how to loosen the neck up, and a best way to do this is to, we're going to actually start on the breastbone right here. And he has two ribs right here. I'm going to have you tilt your head back the other way. And go forward. And then again. Okay, now have a seat right here, Tony. Let me show you a better way to do this. Okay, go ahead and do back. Yeah, and go forward. This is much easier. Okay, now, when you're stressed, the shoulders go up, the pecs go in, and the guy goes down like this. So everything's right there. So we want to stretch this going backwards. Your neck's starting to become loose?
Yeah, it is loose now.
Okay, so now go ahead and stand up, and I'm going to turn this around, and then sit down facing that way. So now what we're going to do is we're going to take it to the next level. We worked on the front part, but what about through here? I mean, this is, when you go through stress, the heart works really hard, and the heart will anchor itself to the front sternum and the back part right here. So this particular treatment is wonderful for the heart and for blood flow and stiffness in the neck, and lots of tension in the neck can come from a heart that's overworking. So you just take your thumbs right here and press into them and have you tilt your head back all the way, Tony.
Listen.
Yeah, and go forward. Okay, go back.
It's really tender.
Good. See how he's pivoting over my thumbs? He's arching right here. Good. Good. This is great for neck pain.
I can't really usually even put my neck back that far.
Now, I'm feeling, and it's feeling tight, and then it loosens up, and then we're going to come right down here, and he's going to pivot over this thing right here, and then one more right here. Okay, so now, okay, now Tony, face this way a little bit sideways, or this way here. Okay, so tell me how your neck is doing now.
It's definitely not as tense, and neither is the shoulder. Still a little bit, but I mean, the main thing I noticed was it really kind of, like what you said, it kind of went mushy.
Yeah.
It was really stiff.
Yeah.
And it really softened up.
Okay, so now, so that's cool. So this, you learned two things. Now we're going to take it one step level. Go ahead and stand up. Let me move this away. And then lay on your back, Tony, right here. Okay, so I want to show you something that if the neck won't loosen up, we're going to actually realize that you're going to have to gently press on the gallbladder. I can feel this gallbladder is really, really in a knot. And just gently, you're going to hold pressure here. And the neck is influenced by the gallbladder because there's a nerve that goes from here all the way up to the neck. And if the nerve is tight, it's always going to cause stiff neck. And I'll be working on this neck for the next 10 years. It will never get better. In fact, in college, the reason I got into chiropractic school is because my right shoulder hurt so bad. And little did I know it was my gallbladder and my diet. But I can't be Tony's diet because his diet's perfect, but other people. So what you do is you just kind of, right here, you have this rib cage. You're just going to press like right there and kind of hold this pressure, and then it's going to relax over time. I tried to get a job as an interrogator, but I pressed too hard, so I became a healthcare practitioner. Okay, relax. So the point I'm making is that if I do what I did to his neck and there's still a little bit left, then it's not coming from his neck. So you have to realize that things are referred. When you learn the advanced technique a little bit later, we would have found this and we would treat it a little bit differently. But you have to realize when you're pressing the gallbladder, you don't have to press that hard. Just hold some light pressure for about 2 minutes. Now, to speed it up, I can go a little bit harder, but it's obviously tender. Right, Tony?
Actually, you were right. It kind of got better after the first initial part. Hurt like that.
Yeah. So I'm going a little bit deeper just for the demonstrations. It's for the cause, for the video.
Thank you.
Just to speed it up right here. But anytime you press on this area and you can't go in at least 3 inches and it's that sore, always ask the person what they're eating that they shouldn't be eating. And then and then have them reread the chapter 10 on my book.
Okay, I'll do that.
Okay, and what's your social security number? No, I'll tell you. Okay, right there. Okay, so I just kind of loosen it up. Now let's have you sit up for me and face this way, Tony. Okay, so now how is the neck now?
Yeah, well, my attention's on this right now, but no, the neck's actually, it's way loosed up. There's still a little bit here, but it's actually much different. It's much improved.
Okay, great. Lay back on your back.
It's this side is the only one that I feel.
Well, when you eat certain things that is not good, you want to work on the pancreas. It's on the other side. So we did the gallbladder, so we have to do the pancreas because they both are affected by chocolate, breads, pasta, cereal, crackers, biscuits, waffles.
I should have said that, should I?
After a while, the patient stops complaining, and that's the great part of the technique, is that we get a 100% cure rate. The patient says, "No, I'm fine. I'm cured. I'll never complain again." But yeah, the gallbladder. I mean, this. I don't know why I'm wasting my time on his neck because it's all coming from right here.
Is it?
Yeah. But typically, if you don't have this problem, the other maneuvers will work great. I'm almost glad that it didn't go away quickly because I wanted to show you that it doesn't always go away that fast. You have to dig around and find out where things are coming from. Okay, now let's have you sit up for me. Tell me.
It is. I mean, the shoulders are actually completely fine now. You know, I don't know if I want. I don't know if I want to say this, but it's just now there's just a little bit in the neck. Like my shoulders, actually, I have no pain.
Right.
Now there's a little bit of tension I feel here, and that's actually about it.
Okay.
Yeah.
Now,
but I think I'm good.
Yeah, I thought you'd be. So what happens is that's just kind of an example of how you could work on different things. And in the next video, I'm going to show you how to get rid of some other problems.
Here's another powerful technique, old injuries. You probably have had many, many old injuries. Maybe you haven't, but if you have, if you're like me, which basically here's an example of me, and you had sinus surgery or you had a rock thrown at your left bone underneath your face there, a rotator cuff injury from high school, tonsil removed, blow to the neck from a punch. All these old injuries, you really want to list them. Okay, so you list the old injuries and guess what you're going to do. That's right, press on the opposite. Now, you might not have pain in that area, but this has left an impression on your physical body that is still stuck in your body. Alright, it's stuck in there, and it shows up later in life as stiffness, tightness, arthritis, and other related problems, including fatigue. And when you work on the opposite side, you actually release the old injury. That's how you fix it. When you release the old injury, guess what happens to your adrenal glands? They now can have more capacity to work. It's very similar to closing the application on your desktop. So go ahead and press on the old injury, and in the next couple of videos I'm going to show you how to deal with an old chronic whiplash injury, an injury to the tailbone, and some other ones.
Okay, so now in this video I want to show you a common injury that people have is in the tailbone. This is for people with low back pain. So we already talked about going through the front part and working on back pain through the front part, but now the question is, what if he hit his tailbone and he has tailbone pain, or he jammed his butt? Where is the force? The force travels all the way up to right here. The force is right in the back of his skull. So any type of fall on the butt will go right up to here and it gets stuck on the top. So what we're going to do is we're going to take your fingers and come up this way. So I'm just going to come up this way here and then kind of turn the head like right here. And I can even take my thumb coming up and then rotate the head around the thumb nicely like this, and then I'll move my thumb to this side, and then there's this little crest around here. I'm just going to work the crest, and then if you see my thumb, I'm inching it back this way, and then I'll just take my middle finger and I'm just going up this way. Okay, so, and then on the top part of the head, the force will go all the way up here too. I'll just press down this way as well. And have you ever fell on your tailbone?
Yeah.
Okay.
I've fallen a bit when I was skateboarding and BMXing around.
Okay, so we just work the top of the head, which is tender. It's interesting, the force actually gets stuck way up here. Okay, and then I'm just going to take, I'm going to just show you how I would normally do it. Okay. Okay. Now, what that's going to do, loosening this up, is going to help loosen his back up, because the cable from the spinal cord all the way up to here, all the different coating around the spinal cord, it's called meninges. They attach to right here and all the way in your tailbone, and that's going to actually lengthen everything and make him feel like he's taller. Okay, so that's going to actually help relax you, and so that's how you would fix a tailbone injury. In the next video, we're going to show you how to fix a whiplash. So we're back, and we're going to talk about how to handle whiplash. Have you ever whiplashed yourself? Car accident?
Yeah.
Okay, I think you pretty much had a lot of injuries here. This is a perfect example.
Not many severe, but yeah, I've beaten my body up a lot. So.
Yes. Well, thank you for doing that for the video.
You're welcome.
I've also done similar things. When I was about 4, I was hanging upside down in a swing set. That was before I thought I could fly, and I let go, and 3 feet I right on my head. And I remember my whole head, I felt flat. And I'm walking around going, ow, it just really hurts. And after that, I was kind of afraid of swing sets, so I kind of like didn't go on them anymore. Now, what happens is whiplash, you get usually hit from a rear end collision. So the first action by hitting from the back is this right here.
Yeah.
So it's like this, and then it's forward. Okay. So think about what happened. When he's going like this, he's ripping all these.
Horrible for the neck.
Yes. So he's going back like this. He's compressing this. So the best way to fix that is you have two collarbones right here. We'll take our thumb and finger, hold it there, and have him go back and forward. And keep doing that. And I'm just working that out. And I'm spreading my thumbs out a little bit. More.
I feel that all the way down in my arms for some reason.
Wow. And I'm lifting it up a little bit. Okay. I'm supporting his back, lifting it up. And if you don't have long fingers like I do, you can do one side at a time with your thumb. Okay. And what's happening is we're fixing some chronic tightness in the back. This is for like an old whiplash injury. Of course, if it's an acute injury, you don't want to do it. He wants to go to some type of professional. But this is for like the person that had a whiplash like 5 years ago. And that's going to make his neck feel really calm. So that should actually explain how to do the whiplash. And that's pretty much all I do for whiplash.
Okay, we're back, and hopefully you're hanging in with me. We're just going through this one by one, and we're building and building on your techniques here. This technique is called upper and lower body part coordination. Now, there's another term for this I didn't want to give you, but might as well give it to you. It's kind of a long word. It's called contralateral relationships. Now, what does that mean? Contra meaning opposing, lateral means on the outside. So we have this relationship between the upper part of the body and the lower part of the body. If you take a look at the left hip, for example, that correlates in Chinese medicine with the right shoulder. Okay, so when you walk, this follows this. So the right shoulder follows the left hip, and that allows everything to be coordinated. So you have actually a nerve that connects to both of them, which means if you affect one, you'll affect the other one. Now, the right bicep will affect the left thigh. Interesting. And then we have the right elbow will affect the left knee. And then the right forearm will affect the left lower leg. The right wrist, left ankle, left thumb, left big toe, etc., etc. So now what do you do with all this? Well, let me just show you in this next slide. Let's say, for example, you have pain in your left inside of your knee. Well, you can press, to fix it, you can press on the upper part of your body on the elbow, because elbow and knee are the same thing. So you'd actually go and press on the inside of the elbow on the left side to get rid of your pain on the right side. This is quite magical. It's pretty cool, but this is all about Chinese medicine on the relationship between the upper and lower parts of the body. Now, if you had pain in your left inside of your elbow, you could press on your right inside of your knee. So you could go both ways. So it's quite amazing. So if we come back here and see, you'll see that the hip on the left side correlates with the shoulder on the opposite side, and then we have the elbow to knee, wrist to ankle, fingers to toes, and that just kind of gives you an idea. Now, we could take it one step further and talk about, let's just talk about the upper arm here. You have this thing called the bicep that flexes the arm. Well, if you look on the lower leg on the opposite side, the back part of the leg is called the hamstring. That flexes the leg. So the flexor muscle would correlate with the flexor part of the arm. So in other words, if you had a muscle problem in your hamstring on the left side, let's say you even tore it and it's sore, well, guess what? On your upper bicep part, which is the flexor, that's the correlating muscle, that'll be very, very tender. So the more you work that bicep, the more you help the hamstring. And then on the tricep, on the back part of the arm, if you work on that, you'll affect the front part of the leg, which is the thigh muscle called the quads. So again, it's going to take you a little bit to kind of think through it, but the principle is right here. So that's what I want to focus on. Okay, it's me again. All right, now we're going to give you one more technique, and these are just little layers to your knowledge base. We're going to talk about the knee for a second. Now, if you have pain in your knee, we talked about working on the opposite knee. We also talked about working on the opposite, same knee, but the opposite side. So in this technique, this will give you one more added benefit to working on a knee. And instead of working on the knee, it's on the opposite side, you have to realize the person, especially if it's a chronic injury, has been limping. So you develop secondary compensating muscles, because I'll guarantee if you actually limp for more than a day, you set up a lot of tension on the supporting leg. So by getting rid of that old supporting compensating tightness, you give this knee a chance to really heal nicely. So if you have pain on the right knee, work on the opposite muscle a little bit higher up, right in the belly of that muscle close to the hip. And it's going to be really tender, so work it out all the way up and down, and even maybe on the side right here, and that'll just pop that pain right out of there. You'll feel really, really good. Okay, now let's just take the carpal tunnel syndrome. If someone has pain on the wrist, same principle goes. You can work on the opposite wrist, but you can also work a little bit further up on the muscles right through here. And again, if you had elbow pain, you would work on the opposite bicep right here. Okay? So just kind of take that in consideration. If you had ankle pain, you'd work on the opposite calf. Now, let's talk about shoulder pain for a second. We've talked about working in the opposite shoulder. We talked about working in the opposite hip. But there's a couple little points to the shoulders. If the person has right shoulder discomfort or neck, that typically is being referred by the gallbladder. And I'm not saying they have gallstones, they just have a sluggish gallbladder. Maybe they ate something that is causing this referral type pain. In the more advanced technique a little later on, you're gonna learn this, but I just want to show you a real quick way to get rid of shoulder pain. I don't care if the person had an injury there, just suspect that gallbladder and try this one little technique. Just place your fingers over the gallbladder just gently and just kind of massage that little point right underneath the right rib cage. Hold that for like a minute and then ask the person, hey, do you feel better? And if they do feel better, then we know it's referred. And then you can ask them the next question, are you eating anything that you shouldn't be eating? And the person inevitably say, yes, I've eaten a whole thing of meatloaf with the grease and all that bacon I had, and we had deep fried night. Well, obviously that's what's causing the problem. Okay, so now if they had the gallbladder removed, that's an injury. We would work on the opposite side over here. Okay, so that's one technique, but now there's another piece of the puzzle, and this is a really kind of a great, amazing demo that I do for people if they have rights. This is mainly for, this could be used for pain, but muscle weakness. Let's say they can't raise the shoulder above their head on one side. Okay, and this works like 80% of the time, and it kind of blows people away. All you do is you press on the opposite calf. Now in the last technique, this would be pressing more on the hip, but this technique seems to work as well. You work on the opposite calf muscle. Just work that out. So if it's the right shoulder, it's the left calf. Now it's going to be tender, but go ahead and work it out all the way down to the ankle right through in here. I like to work close to the ankle by the Achilles tendon, a little bit higher, and you work all that out and then have them raise their arm as you're pressing, and their arm goes higher, 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 and they're going to be going, this is amazing. Now, you can also, if it's the opposite shoulder, work on the opposite calf. But it doesn't work if you use on this, press on the same side of the calf. Okay? So that is some additional techniques you can use to have fun with. I'll see you in the next video.
Hi, as you can see, had a little situation here of my arm here. I was wrestling around with my son, who's 180 pounds, in the kitchen, as my wife was telling me not to wrestle in the kitchen. He went back, his head was going to hit the back of the stove. I grabbed him and I braced my left arm as hard as I could, and I just snapped my humerus. Basically the humerus should be like this, mine's like that. So I went to the ER, went through a lot of extreme pain. Now I have a lot more sympathy for people who are in severe pain, because that was the most excruciating pain I've ever felt in my life. And now I know what my wife feels like when she said she was pregnant, but probably not to that degree. But anyway, I went to the ER. It was fractured. So then now I had to wait over the weekend to get surgery, which I was not excited about. But I had to get a plate on my shoulder that went from here to here, because the rotator cuffs also detached from the bone, and they had to nail those back somehow. So they have screws and bolts and all sorts of things in there. So on Monday morning, I went in at 8 o'clock, and I finally got in to the surgery at 12. So here's another interesting experience. I hate waiting in doctor's offices. So now I'm on the other end. I'm the guy waiting, and so now I'm never going to let any patients wait, because I've done that in the past. So I'm definitely learning some interesting experiences here. But so what happened was we went into surgery, and it was like a minute later I was just waking up, and I look at the clock and it was 3 hours later. So it went really fast. So I was happy about that. But as my wife took me home, my blood pressure was really low. So I got home, went to bed, and I just could not urinate, which is one of the side effects of the medication. I was heavily drugged. So about 3 o'clock in the morning, I had enough. I told my wife, take me to the ER right now, because I haven't gone to the bathroom. So all that toxic waste in your body. So I went back to the hospital, waited an hour, and they evaluated me, and they said, well, we're going to put a full catheterization in you. And I'm like, what is that? They go, oh, don't worry about it. It's just going to be some slight pressure. That was another painful experience. So they took out 1 liter of fluid from my body, which was pleasurable to get that out. But then I had this thing inside me that was even more uncomfortable, because they taped this bag to my leg, which I was walking out of there going, this is not going to work. So I had them retake it out, and I said, just let me go home. I just want to go home. So I go home, and gave me all these drugs to take, and they were like saying, yeah, you have to take these drugs. But I remembered there was a remedy that I used on some patients in the past called chlorophyll pearls, which is this thing right here. Chlorophyll is like liquid, like the blood of the plant. It's like liquid sunshine. It detoxifies the things that cause pain at the nerve endings. So as soon as I got that in my body, like the pain just went right away. So I really have not taken any medication. So it's been 2 days after the surgery, and I have no pain in my arm at all. So it's healing fast. I'm doing the acupressure on it. So I will keep you updated on how things go. But this was definitely an interesting experience that I don't want to experience ever again. Talk to you later.